our question and our demand is why.
For the second year in a row, the Zone Rose is back in action in Montreal's Gay Village. The shipping container turned HIV and STI testing clinic continues to see foot traffic as HIV cases rise in the city. And the advocate behind the project is calling on the Quebec government to give free access to HIV preventative medication, as some other Canadian provinces have already done.
With the housing crisis and the inflation and everything, it could be a barrier, to continue to take PrEP every day. But sexuality is going on. It's still continuing.
The medication is called pre-exposure prophylaxis, also known as PrEP, and it's taken by those who are HIV negative but at risk of exposure to HIV. It reduces the risk of getting the infection by more than 90%. In Quebec, people with health insurance coverage can pay between $70 to $100 a month for the medication. However, if someone doesn't have health insurance, they can pay up to $250.
We try to advocate in Quebec to have for free.
In Alberta, British Columbia, and Saskatchewan, at-risk individuals get the medication for free through their provincial health insurance. And in Ontario and Manitoba, it's free for those 24 and under who don't have private insurance coverage. HIV specialist at McGill University, Dr. Jean-Pierre Rudy says free access to PrEP will reduce costs long term.
And will be much cheaper maybe to pay to have free pills to prevent HIV than to treat HIV for maybe 40, 60 years.
The HIV epidemic is on the rise again in Canada, with more cases in Quebec than the national average. Data from the Public Health Agency of Canada shows that in 2022, there were over 1,800 new cases of HIV. Quebec's rate is 4.9 cases per 100,000, slightly above the national average of 4.7. And in Montreal, data from the city's Public Health Agency shows a 120% increase in cases in 2022.
Maybe the PrEP is not fully available or discussed to a patient or person at risk. And also we have a lot of new migrants.
A statement from Quebec's health ministry reads in part, currently there are no plans to reimburse 100% of HIV medication costs. These medications are partially reimbursed by the General Drug Insurance Plan. It's worth noting that economically vulnerable individuals, such as those receiving social assistance, receive free medications under the Public Drug Insurance Plan, which includes HIV medications. Moreover, several generic versions are now available, reducing costs.
It can consistently reduce the new cases of HIV. So why we don't have more access to PrEP?
In Montreal, Swidda Rassy, City News.